Donovan.
I'm Jeremy.
And I'm Justin.
Imagine giving birth in one of the best hospitals in the world, surrounded by the most advanced technology, and nearly losing your life because no one believes in your pain. My name is Skye Moses, and this is how systemic racism in healthcare almost killed my idol, Serena Williams. After delivering her daughter, she felt shortness of breath and she knew something was wrong. She had a history of blood clots, but her concerns were initially dismissed. It took her insisting to get the necessary scans, which revealed life-threatening clots in her lungs. Her story is not an isolated case. It highlights a broader issue that's racism in healthcare, racism bias in healthcare, biases that affects people's safety, their treatments, and sometimes their lives. Today I want to tell you that systemic racism in healthcare is real, harmful, and something we all need to care about and take the steps to change. Let's talk about the data. Black Americans face higher rates of chronic illnesses like hypertension, diabetes, and even heart disease. They're more likely to suffer from complications from these conditions and less likely to receive adequate treatment. Black women are about 3 times more likely to die from pregnancy-related causes than white women, and that's even when their income and their education and their insurance are all the same. These aren't just statistics. They represent real people, like real mothers and fathers and daughters and sons, and these outcomes point to deeper issues in how care is delivered, how symptoms are perceived, and who is believed when they speak up. Serena's story isn't isolated. Let's talk about Dr. Suzanne Moore. She was a black physician who contacted COVID-19 back in 2020. She was admitted to an Indiana hospital, and she despite being a doctor herself, she had to beg for pain medication and proper treatment. She posted a video from her hospital bed saying, quote, "This is how black people get killed when you send them home and they don't know how to fight for themselves," end quote. Sadly, she died shortly after. Her case made headlines showing that even a medical degree doesn't protect you from racial biases. So this isn't just a few bad doctors making bad decisions. This is a systemic issue. The first key factor is implicit biases. Many healthcare providers hold unconscious stereotypes that affect how they treat people. In 2016, a study, some medical students falsely believed black people feel less pain than white people. This kind of thinking directly affects how patients are diagnosed and treated. Another issue is medical education. Most textbooks and training materials primarily show symptoms on white skin. That means that providers may miss signs and illnesses in patients with darker skin, especially with conditions like rashes and infections or even bruises. This is not just people. Sometimes the tools themselves are biased. For example, a pulse oximeter. These tools are used to measure oxygen levels by shining a light through the skin to measure how much of the skin is absorbed by oxygenated versus deoxygenated blood. They were found to be less accurate on darker skin. During the COVID-19 pandemic, this meant some black patients appeared healthier than they really were, delaying critical care. That's an example of technology unintentionally contributes to racial health disparities. Consider something as basic as measuring kidney function. For years, the common EGFR test used a race correction that adjusted results higher for black patients. This made it seem like their kidneys were functioning better than what they actually were, delaying referrals to specialists, even kidney transplants. Only in the last few years has this practice started being removed from medical systems across the country. Access to care is another part of the problem. Many predominantly black and Latino communities have fewer hospitals and fewer specialists and higher rates of being uninsured. This makes it harder to receive early preventative care, and easier for conditions to become severe before treatment even begins. All of this adds up to a system that produces unequal outcomes. Even if no one intended to discriminate, that's what makes it systemic. Now what can we do? First, we need to speak up. If you're going into healthcare, or even if you're a patient, be willing to ask these questions, challenging assumptions, and advocate for fairness. Second, educate yourself, learn how symptoms appear on different skin tones, understand how unconscious biases work. Know the history behind why some communities may distrust medical institutions. Third, support reform. That includes better training in medical school, policies that improve access to care, and programs that increase accountability for biases in decision making. In conclusion, this isn't about blaming individual doctors or nurses. It's about recognizing the pattern and choosing to be a part of the solution. Let's go back to Serena Williams. She had money, she had influence in the medical knowledge to advocate for herself. But not everyone does. If someone like her nearly died because no one listened, what happens to people without that voice? Systemic racism in healthcare costs lives. The more we understand it, the more we can help stop it. Thank you.